Hello everyone, this is Bob Browner with update number 31. Back to twice a week now because a lot's happening in the world. So I thought I'd kind of review some things that are coming out in the newspaper and what people are hearing in the newspaper and try to put them in a little bit of context. Themes today are myths, misconceptions, and effective plans. And what are they? And so I've talked to a lot of folks and I keep hearing kind of common refrains. And one of them was, but we flattened the curve, right? Aren't we done? And the answer is, well, no, we did, yes, we did flatten the curve a little bit, but not enough. And because we didn't flatten it enough, well, the fires started back up again. And so here's Lancaster County where we had the spillover from Crete and the Smithfield plants. We did get things under control. We were headed in the right directions, but we didn't go all the way to where we needed to do. We didn't have anything, the effective interventions in plan, and it's been going up steadily for more than 3 weeks now. And so yes, we flattened it, but then we didn't finish the job. Another thing you'll see is there's a lot of controversy in Lincoln about what those risk dial thresholds should be. And this is not a hard and fast science. There are multiple metrics out there. The one I'm using is the one put together by Ali Khan at UNMC. There's another one out there by Harvard and COVID Local. I think either of these could be right. Why am I using this one? Well, the reason why is Ali has been communicating with people all over the world, and basically what this fits with is fits with what other countries have done. So if you look at this 2.5 to 5 per 100,000, at a country level, it's also expressed in 25 and 50 per million because it's a million, not 100,000. Well, what did other countries do? Well, if you look at the countries that are successfully tamped down their epidemics, France, Germany, Italy, Spain, they got it into that 25 to 50 per million, or 2.5, less than 2.5 per 100,000, which is what we're using as that threshold, and they got it to continue going down. So they started cautiously opening, but they kept doing things and they followed that trend down. They didn't just open back up and ignore the trend again. And so what we're doing is we're using this trend, not the Harvard one, because the Harvard one hasn't been proven to work yet, like it's been proven to work in France and Germany and the Netherlands. If you look at these numbers, basically, Germany has gotten its epidemic tamped down. They started like we did, but they got it under control. They followed it down and then cautiously reopening, but they made sure that it kept working as they went along. They didn't just figure they were done and walk away. And if you look at us right now, almost nobody in the United States did what Germany did. There's a few states that I think learned their lessons and are getting numbers way down and where they need to be, but most did not, including Nebraska. And one thing I'm highlighting here for Texas is where Texas was 19 days, about 150 per million or 15 per 100,000. That is exactly where Lincoln, Nebraska is right now. So in Lincoln, Nebraska, we are where Texas was 19 days ago. So it's really important for us to react and make some changes right away in Lincoln so we don't let things continue to spiral out of control. Because basically this is what we're at. We're at the beginning of what looks like exponential threat spread. We need to throw it down, and this is that 14 to 15 per 100,000 where Texas was just 19 days ago. Now I'm pretty confident we'll do something here in the next few days. I just don't know for sure because that's not my role. So essentially, the fire department came, but they didn't finish the job. They may have put the fire in the attic, but they didn't go in the attic to make sure all got put away. And so when they left, it went back, it sprang back into again, and now we're where we are. The other thing I heard, Senators Erdman and Halloran apparently think we should go for herd immunity. Well, what is herd immunity? You really need to do the math first. So the herd immunity math, this is complicated and probably doesn't make a good slide and violates most recommendations for PowerPoint slide, but there's just no way around it. Herd immunity is a complicated beast. Most experts think we're probably in the 70%, but let's just be cautious and say, okay, maybe 40% is herd immunity. Well, you need to do the spreadsheet, run the numbers, and we've even run some numbers, Ted and I, of, well, what if we're undercounting our cases by a factor of 5? What would it be then? Well, you got to do the math. How many people in Nebraska times herd immunity times how many people who have already been infected? How many people does that mean you would have to infect if you want to do this in a year's time? How many people per day would you need to have infected? It'd be somewhere between 18 and 3,600 people infected per day. And our worst day so far is 677, by the way. So we'd have to have an infection rates much higher to get to herd immunity in just 1 year. And what about hospitalization rates? So about 5% of those roughly would be in the hospital. So depending on what your math is, it's anywhere from 33 to 60,000 people hospitalized. The daily hospitalizations, you'd have to have 90 to 180 people admitted per day. And if you use an average length of stay of 10 days, that means 900 to 1,800 hospitalizations at any one time in Nebraska. We actually do have the hospital capacity for that, but you'd have to clear out a lot of other people. You'd have to have people to promise not to have heart attacks, strokes, deliver, have babies and get into car wrecks for the next year to free up that capacity. We'd have to find enough doctors and nurses to run our hospitals at that capacity as well. That's going to be really hard to do, folks. And we already know that influenza is going to come in the fall. Other things will happen. There's no way we can free up 1,800 to 900 beds at any one time. And then on top of that, the projected fatality rate, even if you got it perfect, that you're looking at least 6 to 13,000 Nebraskans dying by going to herd immunity. Well, to do this, you would have to get it perfect, and I'd ask you how many government projects have gotten something this tight, this perfect for a year, something that's literally never been tried before. I don't know about you, but I'm a little skeptical about our government's ability to pull out such a complex orchestrated plan. This assumes that you have a very steady state of people getting infected. So what are you going to do? You have intermittent lockdowns when it spreads too fast, and then intentionally infect people when it spreads too little in order to maintain your targets. I have no idea how you would do that. And the number of people dying, even if you got it perfect, would be the equivalent of 20 to 40 Nebraskans per day and executing them. Is that really a pro-life stance, which I believe Holleran and Erdman are pro-life? I don't know about you, but Father Hannibal at Sidney St. Pat's and Father Lawrence at Creighton, I don't think they'd agree with that as a pro-life stance. And then the thing that bothers me is we have cheap and effective prevention methods, masks and distancing, and we literally have vaccine trials starting in Nebraska at the end of July. I work with a clinic that is part of one of those new vaccine trials. So we have a cheap and effective way to not do this. Plus, we have vaccines already in the works. And we know that masking would work if we would do it. So, for example, the models have been run that if the effectiveness of masks, if both sides are wearing the mask, we're in the 75 to 95% effective. And if we got a high enough portion of wearing them whenever they're in indoor settings, we could literally stop the spread of the virus just with masks and a little bit of distancing alone. So laws versus right, and this is complicated. And I know it's going to be really complicated the next few weeks. So the way I used last time, do we ask nicely that you don't run red lights, drive drunk, or drive 60 miles in a school zone? In theory, people would be Nebraska nice and do the right thing, but in reality, that just doesn't happen. So you're going to have to do something. Is it going to be a mask ordinance? I don't know any other way to get there without a mask ordinance, at least temporarily until we can get things under control. If we don't do this, innocent people will die. And so I'm more than open to suggestions. I just haven't heard them. Now, one development that could maybe get us there. So maybe this isn't. It's a little too late. But companies across the country, Walmart, Sam's, Target, CVS, Starbucks, everybody is moving toward mask requirements in business. So these aren't stupid companies. These are very successful national companies, and Walmart is not exactly the home of bleeding heart liberals. They're saying you should all wear a mask. And even CDC Director Robert Redfield this week came out and said that if we get everyone to wear a mask right now, we could bring this under control in 4, 6, 8 weeks. And he said, yes, it would be nice if our president would wear a mask just to set a good example. Other thing I often hear, I can't breathe with mask, not enough oxygen and carbon dioxide. There's a chiropractor who apparently presented at Millard, and I think another one in Lexington. We need to do some basic science. So one reason we need to get kids back in school is to explain the basic science of pandemics. So how big are all these particles? And these probably don't mean anything to you. Picometers, nanometers, micrometers. What is the relative size of this? So I'll turn it into a visual for you. The size of the respiratory droplet that we want the mask to stop is this big in proportion in picometers. The coronavirus, the mask may not stop all the viral particles because that's a little too small. Well, the very people who think masks don't work also think that O2 and CO2, carbon dioxide and oxygen, would be stopped by the mask. Well, they're so small you can't even see them. There's a number there, but it doesn't even fit into the pixels. That's how small carbon dioxide and oxygen are in relation to coronavirus or droplets. The mask will not stop that. And my wife and I have tried the mask experiments where we put the pulse oximeter on, and it doesn't make a difference. So the mask will not stop the oxygen and carbon dioxide for you. So controlling coronavirus means you can't go anywhere. That's another myth, and I think that's wrong, and I disagree with stay-at-home orders, and I've been saying that for months. And the reason is we have plenty of space in Nebraska. It might be different if you're in New York City in a high-rise apartment building. It's just how hard to distance there. We've got a lot of space in Nebraska, and I don't think there's a mask needed if you're outside. The data has been pretty conclusive. There are very few outbreaks outside as long as it's small groups and you're greater than 6 feet away. Now, there is a mask needed if you're indoors or with people outside of your social bubble or in a crowd. You still need to go for 3 to 6 feet of distance even with a mask. And some examples where you should be wearing a mask, and I won't go if nobody is wearing a mask, is grocery stores. If you're at work with other people in the same room as you, I don't go to the Haymarket Farmers Market at all. It's too crowded. There's not enough people wearing masks. But I do go to the Union College Farmers Market because they do have the one-way routing. There's better spacing there, and that most people are wearing masks there. So you can go out, and I would encourage you to go out, go bike, go run, go walk your dog, get out with your neighbors. Actually, surprisingly, I think we've actually gotten out with our neighbors more this year than last year. We just do the safe driveway socials where we make our 6 foot spot in the driveway, bring our own cooler, bring our own chairs, and we don't wear masks for that because there's plenty of space. The kids don't get it or it doesn't spread in kids. So one of the governor's communications people called me to give me a hard time this week about not kids not needing masks and it's being safe in kids. And I pointed out, your own website says 2,600 Nebraskans between the ages of 0 and 19 did get coronavirus already. And so don't tell me that kids don't get it because they do. And don't tell me that it's not young kids, because this is a slide from the Department of Ed, from DHHS showing that almost 10% of those were very young children, 0 to 9 years. So we do know that young children get it. We also know that young children do, although they don't get sick very often, they still do get sick. And this is actual Nebraska's data of the number of hospitals March through June, showing that although there weren't very many, there were 12 children who did get sick. And there is a hope, of course, that it doesn't spread in children. But there are case reports of it spreading in children. This one came out of Catawba County in North Carolina, showing a family outbreak of over 40 that spread to over 40 people at the end of the day. But a 9-year-old child did confirm spread to grandma and grandfather. And so, yes, there is some spread. Now, what we don't know is how much. Is this 1 out of 1,000? Is it 1 out of 100? Is it 1 out of 10? That's the data we really, really need. I've asked the health departments, would you please run that data? Because you have hundreds and from Nebraska, thousands of cases of children. How did they get it and did they spread it to anybody? You should be doing some contact tracing. Please answer this question for us. So what about kids? We know it spreads from adult to adult. We know it spreads from adult to kids. It looks like it might spread from kids to adults. We just don't know how much yet. Ideally, it's low, and I told them I really, really, really wish it's extremely low because, boy, it would be easy to have elementary and preschool without masks if that were the case. We just don't have the data yet. So, in summary, I think, we need to put in an effective plan, and we know what it is. We actually have seen other countries do it. We have a cheap and effective prevention measure, which is just masks and distancing. Masks don't cost much. Plus, vaccine trials are literally starting in Nebraska in 10 days. So we're already making progress in that area. What we need to do, though, is we need to slow down the spread, and we need to keep it there next time. We were successful here in Lincoln, for example, for a while, but then we opened up too fast, too soon, and did not react for weeks. And we need to not repeat this mistake again. So this is what I do, and hopefully this is helpful for you to keep in mind. Of course, it doesn't represent the view of all of my people I work with, but this is just so you know what I do for a living.